Hello, fellow hospitalists, and welcome to Documentation Talks with Dr. Tom. My name is Tom Fredrickson, and I'm the System Vice President for Physician Enterprise Hospital Medicine Operations, but I'm also a practicing hospitalist. Like all of you, it is important for me to do great clinical work. But in addition to that, we need to get credit for the great work that we are doing. Because of that, we are rolling out a series of videos on clinical documentation designed to help you document like a genius. The first installment that we are rolling out today is on encephalopathy. As hospitalists, it is common for us to admit patients with altered mental status. These patients are often very sick, as you know. They often have sepsis, or they may have a blood sugar of 900, or a sodium of 106, or have a subdural hematoma, or any number of serious medical conditions. We use our years of training and experience to treat them, and they often have good outcomes. But unless we document correctly, we will not get credit for our great clinical care. And here is why. After the patient is discharged and data is fed into the black box that determines how sick your patient is on paper, unless you've used the correct terms in clinical documentation, you will not get credit for your great clinical care. Here is why. In the world of clinical documentation, the term altered mental status is a symptom, not a diagnosis. Any disease diffusely alters the function or structure of the brain is an encephalopathy. Encephalopathy is easy to document correctly. All you need to do is tie it to an etiology and indicate chronicity. Chronicity is straightforward. For the patients we care for, that is usually acute, but it could be subacute or chronic. Etiology is likewise very straightforward. It is your clinical judgment about why the patient has altered mental status. So, as an example, in the patient with a blood sugar of 900, complete and accurate clinical documentation would be acute metabolic encephalopathy due to hyperglycemic hyperosmolar syndrome. In the patient with a subdural hematoma, complete and accurate documentation would be acute traumatic encephalopathy due to subdural hematoma. As you know, there are many other etiologies for encephalopathy, such as toxic, hepatic, hyperglycemic, hypoxic, hypercapnic, Wernicke's, and so on. Now, for a quick word about delirium. Delirium is a special subset of encephalopathy. If your patient has a delirium, please document it and tie it to an etiology. But know to get full credit, A+ documentation, you also need to document encephalopathy, tie it to an etiology, and indicate chronicity. Now for a quick recap. Altered mental status is not a diagnosis. In the world of clinical documentation, it is just a symptom. In order to get full credit, A+ documentation, you need to document encephalopathy, tie it to an etiology, and indicate chronicity. It's that simple. So, thank you very much for listening to this month's installment of Documentation Talks with Dr. Tom. We hope you enjoyed it, and we hope you also turn in next month when our topic will be everyone's favorite, malnutrition. Take care, hospitalists.